This is a giant blister, presumably from some sort of burn. We typically recommend that you don't pop these because by popping them, you expose the underlying wound to bacteria, which can lead to an infection. But in this case, the blister was so big, popping it was actually probably the best option. And they do it with excellent technique. You see they have sterile gloves, and they leave the outer layer as a biologic dressing. So let's talk a little bit about burns. That was a second-degree burn. That means it involved the epidermis and the dermis. Most burns, like sunburn, are first degree, involving only the epidermis, and then there's third degree, which involves the subcutaneous fat. That's much more serious and usually needs a skin graft to heal. But oftentimes when you get burned on the stove at your house, it's going to end up being a second-degree burn like this. And what I typically recommend as soon as you get burned is run your hand under cool water for at least 5 minutes just to calm the tissues down. If you do get a blister, I would watch it at first, but if it gets bigger, you certainly can consider popping it, something like this, but just make sure you monitor closely for signs of infection.